Hi, I'm Tammy Bryant, Program Chair for the ASN program here at Southern Regional Technical College. I started at Southern Regional Technical College in 1993 in the Practical Nursing program as an instructor there. Since that time, I've moved from the Practical Nursing program, established a gerontology program that our college had, and now I'm the Program Chair over the ASN program. I've been in the nursing career for about 33 years now. Our ASN program here, it has, for our Thomasville campus, we average around 160 students. Our students on the Thomasville location this semester, they're learning about a couple different things as we have multiple cohorts that start in the fall. So our first cohort is a fundamental cohort, so they're learning the basic skills here in our virtual lab that start off with basic vital signs, bed making, those kind of skills. And we go as far as to have a senior cohort this semester as well, who also do their clinicals in our virtual hospital and at the settings at our local hospitals, and their preceptorship in their senior programs as well. Through our virtual hospital here, they can do up to 30% of their clinical time here working on our mannequins. Nursing is a wide variety of partnerships with multiple clinical facility sites. Our main site here for our Thomasville campus, of course, is Archbald Memorial Hospital. We also utilize the health departments here, some of the doctor's offices here. We've also been very blessed just recently to have a connection with PCOM, which is the Philadelphia College of Osteopathic Medicine, and they allow our students to do some interdisciplinary work with them. And the fact that they can go up and run some simulations with them, attend post-conferences or debriefings with them. And so it allows the students to see not only the nursing perspective, but also into the physician perspective as well. The ASN program at Thomasville has a 10-bed virtual hospital. The hospital was designed to look a lot like Archbald Memorial Hospital's North Tower. The reason for that is our students in this program are trained on the equipment and the specialty items that are used at Archbald, because they employ most of our students from our Thomasville campus. So we want to make sure that we train them so that they're program ready and they're work ready when they leave us. In our virtual hospital, we have 6 what we call MediMan or iStan or simulators. Our simulators cost us about $80,000 per simulator. They have heart sounds, lung sounds, bowel sounds. They will talk with you. They will let you start IVs on them and have a return. They'll have urine output. We can make him cry. We can make him seize. We have a birthing mannequin that will actually birth the mannequin for us. We have a pediatric mannequin that will go cyanosis on the students. We will watch to see if they notice that, and then it can actually go into full cardiac arrest. Both our babies and our adult mannequins. Our senior students do practice a full code in here on our mannequin before they're sent out into the workforce, so they've had that experience of running a full code. Besides our simulation mannequins, we have IV start arms so that they can learn how to start IVs not only by locating it virtually through a computer, but they actually put their hands on a IV arm and insert that. And then we have our basic skills models. Our basic skills models are what we use in our fundamental course so that they can insert their NG tubes, insert their catheters, and learn their basic skills. And then one of our best qualities of our lab is we have what's called learning space. Learning space allows us to video the students while they're in here doing their simulation. It also allows us to talk to them from the nurse's station. And then at the end of the day, we can play back their scenario with their group of students into the large classroom, and we can do a full debriefing, and we can compare what one class did to the other class. And it's a very outstanding learning experience for the students, so they can see what each group did, what one group might have done great and the other group needed to work on. So we're glad that we can offer that opportunity. We have 100% job placement in our ASN programs, and that's not uncommon across the state of Georgia, as we all know that we're still in a nursing shortage. Our students are working anywhere from emergency rooms to ICUs to school nurses. A lot of them will do some travel nursing after they get their first year of experience on a med-surg floor. We highly recommend that. But we see that their success stories takes them everywhere. And the most dynamic success story I have is that we have graduates of our LPN program, of our ASN program, that continue their education for their master's, and they come back and teach with us. So we have current staff members who started here in technical education, just in the LPN program, that has gone all the way through and are back home with us. So we're excited that they love the field so much and that they love technical education and will come back and teach with us as well. We see a lot of our students that are not only staying in the area, some of them are going to the Atlanta area, working in the major hospitals in the city area. So they're well trained, they're well equipped, and they're ready to take on the world.
I'm Jennifer Mason, and I am the Program Chair of Veterinary Technology. I began in this role in October of 2018, so almost 2 years now, and I've been in the industry for going on 14 years now, and I was in small animal private practice prior to my role here. Currently we have about 20 students enrolled in our program, and we employ 2 faculty in addition to myself. One is a full-time registered veterinary technician, and the other one is an adjunct at about 20 hours per week. Fall is a busy time for us. We have a lot going on in our department because both classes, the freshman and the senior class, are on campus during this time. We are teaching surgery and anesthesia, laboratory and exotic medicine, anatomy and physiology, just to name a few of the courses. Currently, our students are assisting in a lot of surgeries. That includes spays, neuters, and any other things that may come up, like mass removals or amputations. And our freshman students are currently dissecting their cadaver dogs and learning intimately about the anatomy of small animals. In order for our students to complete all of their essential skills that are regulated by our accrediting body, we have to take a lot of field trips off campus in order to perform those skills on a variety of different animals, including ruminants, equines, and pigs. So we travel to different farms that have all of those animals, including goats, cows, and horses, in order for us to be able to gain those skills. In our department, we feel very lucky because we have a variety of areas for the students to accomplish their learning. We have a lecture hall that comfortably seats 25 or so students when we are not socially distanced. Right now, our largest class is 15 students, so we're able to be 6 feet apart, which is very nice because it's still large enough to accommodate that. And we also, in addition to our lecture hall, have a treatment facility which replicates a functioning animal hospital with wet tables, dental equipment, digital x-ray. And we also have a laboratory with around 20 microscopes in addition to a video microscope for teaching purposes. That's where our dissection is taking place and any of our clinical lab work or microscopy goes on. And then we have an x-ray room and this room that I'm in now, which is our surgery suite. It is housed to be able to accommodate 2 surgeries at one time, and we keep it pretty busy in here. Our accrediting body, the AVMA-CVTEA, recommends or requires that our students complete 240 hours of clinical internship. Our program dictates that our students accomplish 540 hours. So we really feel like the entire semester that these students spend in clinical work is very beneficial to them because they get real-world hands-on experience that we cannot always replicate here in the school setting. Most of our students choose to go into the private practice field in the local area, in our service area here. But there are a ton of opportunities for our students outside of our service area, which includes specialty practice and referral practices, government, industry. There are just so many opportunities for them. Currently, most of our students do go into private practice. We have had 2 who are employed by referral specialty hospitals, and we're quite proud of them. Last year, our department created an MOU with St. Matthew's University in Grand Cayman, where when our students graduate our program, they are eligible to start their veterinary degree down there at a reduced admission. So they really just have to satisfy an interview process and have successful completion of our program here, and they can go on immediately to obtain their DVM degree, which is an amazing opportunity for these students, and they can accomplish that degree in less time than a traditional DVM student. So as I mentioned before, I started here in October of 2018, and at that time the program did not have the best pass rate for the national board exams. We've been working really hard to increase that, especially because now our accrediting body has requirements as far as maintenance of accreditation. And just this past year, we graduated our seniors during COVID, and we have had all of them take their national board exams, and we have an 83% pass rate, which we are very proud of, and we expect that that will continue to increase as we continue to work on this program and make it as good as it can be.